Coming up next on this episode of Best Docs Network featuring Forest Park Medical Center, Dr. Colin Pero, Dr. David Genecov, Dr. Brian Barnett, Dr. Stephen Michelson. Hi everyone, I'm Candace Kruger along with Jim Knox, and we're back once again with the Best Docs Network featuring Forest Park Medical Centers. Forest Park Medical Centers is one of the premier medical centers in all of Dallas-Fort Worth.
And with that, this is an entire show dedicated to Forest Park Medical Centers and their fine physicians.
Absolutely, and we have a great show for you today.
We do, so let's start it off with our first Forest Park physician. It's Dr. David Genecov, who will discuss an innovative way to utilize stem cells.
Biolife started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Genecov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on. Then everybody's a winner.
Mike, who loves his job working at a hospital, had chronic neck, shoulder, and back pain until he met Dr. Peter Beck. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
So reflux disease can be treated initially with taking medications. Antacids, over-the-counter medications are very common. When your reflux becomes more severe, then people tend to go on to medications on a daily basis, which is really not what those medications are designed for.
I was always having to worry about taking medicine, having the medicine with me, and really had to watch what I ate. I had the heartburn and everything for about probably 5 or 6 years before I finally went to the doctor and did something about it.
Medications are really a chemical treatment for a mechanical problem. We're chemically changing the composition of the fluid, but we're not changing the mechanics that keep the fluid in the compartment where it's supposed to be. and that's what surgery does.
When I went to see Dr. Ihde, he explained to me what was actually going on, and then we just set up a scope to go in and check and see if I did have a hiatal hernia and what exactly was going on.
The fundoplication procedure is done with a new device called the esophagus device, and we pass that with a TV camera into the mouth and down the esophagus and into the stomach. And then it folds back on itself so that we can attach to the junction of the esophagus and the stomach. And it has a flap that will fold the fundus part of the stomach onto the esophagus and then put the sutures in.
The surgery went in and corrected the hiatal hernia where the stomach had gone up through my diaphragm, and he fixed that. And then the transoral incisionless fundoplication rebuilt the valve so that the stomach acid couldn't come back up my esophagus.
We usually have them on a 2-week diet of liquids, soups, and then we spend the next 4 weeks with soft foods. And then at 6 weeks they can go back to eating the beef, chicken, raw fruits and vegetables, those sorts of things that are a little harder to get down and would put more strain on the repair.
I'm not in pain every day. I don't have to worry about when and where I've got to take medicine. I can eat whatever I want. It's been great. It's changed my life for sure.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. Time for our next Forest Park physician. Ear, nose, and throat and facial plastic surgeon Dr. Colin Pero helped change one woman's life by giving her the ability to breathe out of her nose again.
For the last couple of years, I started having nosebleeds. They were never very severe. I went to the doctor a couple of times. We couldn't really figure out what was causing them. And then about 4 months ago, they became terribly severe and would last a half an hour at a time. And so I went to my internist who had me do an MRI and said, well, the good news is you have no tumor, but the bad news is you are not formed correctly. So that's when he sent me to Dr. Pero.
One of the newer technologies that we have the last few years to help people with not only nasal obstruction, but with sinus infections and sinus problems is balloon sinuplasty. And balloon sinuplasty has been an excellent advancement in that it is a relatively less invasive or non-invasive technique to help open up the sinuses.
I think I had just a congenital issue, and he said, I really want you to come look at your MRI. I said, but I have just a vessel, I want you to cauterize. And he goes, no, that's really not it. And so I looked at the MRI, and it all made sense because I've never been able to blow my nose on the left side. Well, it's because that left side was almost completely closed.
The way balloon sinuplasty works is if you have a sinus opening that is narrowed and usually congenitally, in other words, people were born that way, and then if they have a little bit of swelling, say in response to a cold or even a weather change or allergies, if you have a narrow opening, if it swells a little bit, it can swell shut. By placing a balloon into the sinus opening, we're able to inflate that opening and make that opening larger. If you then get the same amount of swelling from the allergies or cold or what have you, it's no longer swelling shut anymore, and the sinus can continue to function as normal.
Dr. Pero told me that he would go in and open up the left sinus cavity where it would actually drain properly and I could breathe through the left side. It was just so successful. It was shocking when I went for my follow-up visit, and he took the packing out and said, okay, breathe through your nose. And I did, and it almost felt like I had too much oxygen. It's a huge difference. Dr. Pero was wonderful, and I would recommend him to anyone.
You're in the great city of Southlake, and behind me, you're seeing us in development of our Forest Park Medical Center at Southlake, our latest and greatest iteration of Forest Park Medical Center. Our Southlake facility is a 54-bed hospital, 12 OR, 6-bed ICU facility. It's approximately 150,000 square feet. We know now that this is the production model, if you will, for the Forest Park chassis. And we are approximately, call it 60% complete. This has a completely different feel than all of our other facilities thus far, and it should. it needs to be a representation of the community. When we're choosing our location, Southlake fit really perfectly with where the physicians are wanting to be. This particular location, our real estate strategy is consistent wherever we go, and that's great visibility, great access, and really kind of showcasing the type of care that the physicians will deliver here at Forest Park Medical Center. So here off of 114 in White's Chapel is a premier location from a real estate standpoint to really, again, showcase the physicians. We consistently try to have a hospitality-like feel in every one of our hospitals. Now, you hear many people talk about implementing the hospitality aspect into hospital, but few actually pull that off. And we believe that we kind of take that extra step, if you will, in implementation on connecting those dots. Once we're complete, you'll see water features, exterior and interior. It's one of the calming aspects that is a mainstay for Forest Park Medical Center. You'll see a grand clock tower that's out here, which is something new for us, but it's a nice feature. The one thing consistent about Forest Park is that we're changing and we're evolving. I mean, it's truly amazing.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes to classes on hemodynamics to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts.
The prevalence of skin cancer is only increasing, especially since we live in Texas, in a southern state. Just the amount of sunlight exposure is greater than, say, if you lived up north. And Those who are susceptible can get skin cancers. The most common ones are generally less aggressive. They're called basal cell cancers. You have some more aggressive subtypes such as squamous cell, and then the deadly killer, which is melanoma. Unfortunately, that's more rare.
Back in '08, I had a little spot that was biopsied and came back positive as basal cell carcinoma. When I met Dr. Hall, he said that he would have to do a skin graft using a piece of tissue from my ear. That surgical procedure worked out really well. Scary at first, but it turned out really well. This year, in May, there was another spot on my nose.
In Dottie's case, she had a skin cancer on the tip of her nose, which is a very challenging location because there's not an easy way to just bring the edges of the defect together without creating a lot of distortion. So you're left with some of the other options. Well, skin graft on her was not a great option because of the depth of it. It was going to heal with a divot, something that had been very noticeable. So really we're left with the more complex option of doing a nasolabial flap, or borrowing tissue from the cheek, leaving it tethered to the cheek, and then attaching it to the nose. Dottie had that procedure done, and that trunk was left there for 4 weeks. She was a great patient. She hung in there. We went to that second stage. We divided it. I did some dermabrasion to kind of sand and smooth the edges of the scars, and she's only a few months out, and it's very hard to even tell that she had anything done.
Dr. Hall is just amazing. He's like an angel. He makes you feel comfortable. He held my hand and he said, "Don't worry, Dottie, you'll look great." And I just had to trust in him. When I think about everything that I've been through, I'm very happy, very happy. I still recognize my nose and I think it looks great. Healthy nose, yes. Cancer-free, yes. I'm very pleased.
Had a lot of bloating and pressure in my abdomen, uneasy to breathe, would maybe get scared about it. I was looking at heart attack symptoms and went to the emergency room basically thinking I'm having a heart attack. They even tested me for everything on the heart attack scale, and then we went to further discussion with the doctor at the emergency room. Had a non-functioning gallbladder, was functioning very low, and then ran the test and saw the gallstones were very large, and immediately called Dr. Roshek and scheduled the time to visit with him that same day.
Basically, a gallbladder is something that stores the bile that your liver makes. The bile that your liver makes is what helps digest fat after you eat your hamburger or your fries, whatever it may be. When you eat something later down the road and you have some extra bile stored up from a previous meal or something like that, your brain says, "Oh look, here comes some more fat." Your gallbladder starts squeezing and then more bile comes out.
First meeting with Dr. Roshek, I actually sat down with him. We discussed the history, any previous illnesses. He was very informative and what I loved about him is he listened and he didn't mind questions. He reassured me that the gallbladder needed to come out.
There are two main reasons why your gallbladder can go bad. One is that you develop what's called gallstones. Gallstones are literally stones that form in your gallbladder, and unfortunately these stones can end up traveling out of your gallbladder and going into the main duct. That's the classic thing that causes pain. The other thing that can cause pain is that your gallbladder just doesn't work anymore. It just burns out and it won't squeeze the bile that's stored in there, and actually it hurts when that happens too.
The actual surgery, he told me that it would be laparoscopic. Recovery, he just said that after the surgery, I always constantly be walking, help the fear of blood clots if you're just laying around, just get the exercise of soreness out, and that's exactly what I did.
Once the gallbladder is gone, the main duct that carries the bile from the liver to the intestine will actually dilate slightly, and the duct will become the new gallbladder. When you have your gallbladder and it's not working, we tell patients not to eat foods with fat. We try to minimize your fat intake so that your gallbladder isn't squeezing so often, causing the pain. Once your gallbladder's out, I tell patients you can eat whatever you want.
Dr. Roshek is top notch. He's excited about learning and taking care of people.
For more information on any of the amazing doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And of course, Candace, Forest Park Medical Center and their fine physicians are dedicated to helping change people's lives. And let's meet our next Forest Park physician. It's Dr. Brian Barnett, who helped one couple get the family they always wanted.
Well, we were married in 2005 and tried for 3 whole years to try and get pregnant, you know, and which wasn't working. We came to Texas and spent a year trying here under a doctor's care, and eventually underwent a series of testing and determined that our chances of getting pregnant on our own were less than 8% over our entire lifetime.
Jessica and Philip came to us a few years ago with the need to pursue IVF, in vitro fertilization. They knew about our program, they knew about our success rates, but one of the unique issues with Jessica and her husband were they did not want twins. You know, they were a young couple, they knew the amount of work it takes to raise a family, and one of the goals for them was to achieve a singleton healthy pregnancy.
He kind of walked us through, you know, what the steps would be, what each thing we would do, how we would go through it, and I think a lot of it was just a comfort, you know. I mean, it's a very emotional thing.
We took them through the process of IVF with the placement of a single embryo, and they had a very healthy boy.
So you go through all of the procedure of all of the drugs and everything and the medications to try and prime your body for pregnancy, and you do a retrieval where they take the egg out of your body and they fertilize it and then they inject it back into your body. That's transfer day. And there's 5 days in between typically where the egg lives in a petri dish and they watch it grow and then they put it back into your body, and at that point you either conceive or you don't conceive, but you can't know for 2 weeks.
Another year went by and they came back again, and we did the same thing. They conceived again on the second cycle, and they have a healthy girl.
I went to a Gymboree class. They were talking about how you take pictures of your kids, and I said, well, you know, I have a picture of my son at 5 days gestation. It's just a little blip in a petri dish. You know, those are the pictures I cherish, or those that, you know, we know that we have life at 5 days. There were 2 people in the class that day that were like, oh, I have the same picture. You know, we did the same thing. It was just, you know, really comforting.
At Dallas IVF, we're able to provide the full range of infertility treatments without the need for patients to travel outside the area. The goal of our practice is to have healthy pregnancies.
I'm happy with our results and our process and our decisions.
Anne was suffering from severe sinus problems, and she credits Dr. Colin Pero for helping change her life. To find out more about Anne's story and other life-changing stories, log on to bestdocsnetwork.com.
You know, sports injuries are very common amongst active teenagers, but Dr. Stephen Michelson has helped the boys of one family.
In this community that is growing rapidly, very young growing population, sports injuries are just everywhere.
I was at my football practice and I play quarterback. I was throwing the football and I ended up hitting one of the linemen's face masks and my thumb just didn't feel good.
I've come to see Dr. Michelson for my left wrist being broken, tendonitis in my right elbow, and I dislocated my left pinky. So I've been in here quite frequently.
With Brock and Brady, I see them quite frequently. They're great kids, they're competitive. Sometimes it has been an acute injury, broken fingers and thumb, but sometimes it's a overuse situation.
We can come here for anything, even that's just a worry. Sometimes it's just the emotional part where you think you heard it, but when they tell you you didn't, it feels better.
It's very comforting when Dr. Michelson talks directly to you because you know he's trying to help you.
I think it's important to involve the patient in the discussion, to try to help them understand, because they're so focused on, I want to play in a game. But in the long term, I try to help them understand how the bone heals and how the body works, the potential problems they can have because of it, and try to carry them through that.
He's just like a friend that knows how your bones work, how your muscles work, and you can just come to him for reassurance. It's just really comforting to know someone knows what to do when you don't.
My thumb is 110%. I can move it even a little more now. After all the treatment and what they told me to do, it's perfect.
Each week we receive numerous emails from viewers who have questions pertaining to their health. With that, we introduce this week's Ask the Forest Park Doctor. Today's Ask the Doctor comes from Mary. Mary has a question for Dr. Lowell Ku. My husband and I are trying to get pregnant. When is it time to seek a fertility specialist?
Many couples may wonder, well, after how long should I be worried that maybe something's wrong, and when should I see a doctor? Well, the true definition of infertility is when a couple has been actively trying for over a year without success, as long as they're under 35 years of age. If they're over 35 years of age and they've been trying for 6 months or greater, then they should seek help, and they would be considered to have infertility. So if you are under 35 and you've been trying for over 1 year, or if you're over 35 and you've been trying for over 6 months, it's time to seek help.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Before I had a chance to get with Dr. Hung, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely it just no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, and she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
We talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had my nose fixed, if you will, and so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinus to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
That'll do it. That'll wrap up another edition of the Best Docs Network, which features Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area, Candace.
It absolutely is, and with unsurpassed service, exemplary care, and the highest quality medical facility, prepare to have your expectations exceeded.
And we have some good news for those who want to find out more about the Forest Park doctors as well as Forest Park Medical Center. Head to the website, bestdocsnetwork.com, click on the Forest Park tab.
Absolutely, and if you have a question or comment for us, we want to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.